back to Bump Love. Now that you've had experiences, we're here with an expert, Dr. Doreen Mazakwe. She's a professional at breastfeeding.
The one who breastfeeds professionally.
Well, when you say professional at breastfeeding, you make it sound like I am the standard unit of breastfeeding, which might be true because I breastfed both of my children for more than 2 years. Wow. Yes, exclusively for the first 6 months, but up to the recommended 2 years and beyond. Yes. But in this context, I am a breastfeeding consultant, and that means that I'm the person you go to when you have breastfeeding problems.
Imagine, I had no idea there were breastfeeding problems. Me, I thought just have a baby. I was dangerously surprised.
We had a statistic earlier that in Uganda, only 6 in 10 women breastfeed their babies exclusively for 6 months. I don't know if that's a good statistic or a bad statistic, so maybe you can share more on that. And given the 6 out of 10, I would be more inclined to think that the number should be higher, regardless of whether it's a good or bad number.
Well, the issue with breastfeeding is that, yes, it's recommended by all health bodies. Talk about the World Health Organization, the American Academy of Pediatrics, and our own Ministry of Health. These are things in our policies. They were passed in, not as law, but they were passed in policies as that the best start every child should have in life should be breast milk and breastfeeding because of the benefits that we know. And you might wonder, if it is something that is beneficial to children and mothers alike, families, societies, and the country at large, then why aren't we like at 100%? And well, first of all, not everybody will breastfeed because of so many other reasons, and one of the obvious ones is HIV. There are some mothers who will choose not to breastfeed because they are trying not to pass the virus to their child. Although the recommendation is that mothers who are HIV positive should breastfeed because because they create situations around the mother to ensure that her viral load is suppressed so that she can't pass the virus on. The statistics in Uganda say that 2% of children in Uganda are not breastfed. Well, that is, say, 2 out of 100 children are not breastfed. Well,
that's nice. Seems like a good
yes, it's nice, but it's not nice. Well, nice because it's a small percentage, but why aren't those 2% breastfeeding? But also why aren't those 4 out of 10 children breastfeeding? In this day and age, there is a lot of aggressive marketing of breast milk substitutes. For you, the consumer or the one who buys the breast milk substitute, you probably might not know that someone is targeting you. And sometimes the way they try to target you is unprofessional. And so to that end, there is actually a code from the World Health Organization to regulate how they market their formula. And they call it breast milk substitutes because in certain parts of the world, formula is, and then for other parts of the world, it might be things like cow milk. I don't see aggressive marketing of cow milk in this country as a breast milk substitute. But I do see aggressive marketing of breast milk substitutes. But also there is there's an increased number of women who are entering the workforce. And so there are labor laws which protect mothers and push the hand of the employer to make sure that the mother is, an environment is created around the mother to ensure that she continues to breastfeed. From when I started doing breastfeeding consultancy, I think there have been so many leaps in this area because right now you can see it in the newspapers that employers are being, what's the word?
forced.
I don't want to say the word forced, but they are being told to make workplaces breastfeeding friendly.
Yeah.
And that was not the talk, you know, a few years ago.
Yeah.
Yeah, from my own experience, where I was working, there was no room for pumping or expressing, and I don't know that there were any things in the HR policy that were meant to encourage the mother to breastfeed, other than the mandatory leave of 3 months. Yeah, but I had heard from other mothers that some of them were even called back at 2 months. Yeah. But I think we are going to better places where workplace policies are.
Like I said earlier, for me, I thought breastfeeding would come naturally. And yet, you know, when women have their children, they're hit with terms like you know, latching, and or you don't just hold the baby in your arm, the baby has to sit in your elbow. How do you prepare moms to nurse their children?
The issue of preparing mums is something that is sadly underdone. From my experience, most people are interested in the antenatal visit. As in, you go see the obstetrician or see the midwife, and they do those checks to see if the baby is growing well, ultrasounds, tests, you know. But very few people really sit down to give you some education on what to expect. There was a time I went to see a mother in a hospital, and she told me that, you know, I was mostly interested in pushing the baby, delivering naturally, that all her energies were focused on that. So a mother chooses the hospital she thinks is the best. They, you know, do all sorts of things, you know, in culture to encourage natural birth. But when it comes to breastfeeding, this mother said, you know, I actually did not consider that the child needed to breastfeed. So she realized, she was shocked, she realized at delivery that, okay, so now what do we do? The baby's here and the baby's crying and things like that. So research actually shows that prenatal breastfeeding education is very important in improving the rates of breastfeeding outcomes. And when we say breastfeeding outcomes, we mean initiation of breastfeeding, where we expect the baby to go to latch onto the breast and feed within the first hour of life. And then, so that is initiation. Then there is exclusivity, meaning baby breastfeeding for 6 months without any other foods, including water, except medicines and maybe supplements. Then the other breastfeeding outcome is the duration. So what can be done to make sure this baby breastfeeds longer? And we're not only talking 6 months, we are saying up to 2 years and beyond. What can be done on that? So breastfeeding education, very important. 2, what kind of support does this mother have? Because most of the mothers, especially in the urban settings, have left their family members in the rural areas, and those who are in the urban areas with them are busy. They're working. And, you know, probably issues of space, where does that person sleep? We have apartments and, you know, limited space and all that. So we can't have people coming in to be there for us for as long as we need that support. Because things like work, housework, in the context of sleep deprivation, a baby who has very, you know, high needs and all.
Yeah, we've had all the benefits of exclusivity while breastfeeding. Are there any issues that come with mothers that fail to do that exclusively for the first 6 months, especially?
Yeah, so you derive that from looking at what the benefits are. So for the baby, colostrum, which is the first milk which comes in the first 3 days, is very important for controlling infections. They say it literally paints the gut of the baby so that it is protected from infections or any organisms that cause disease. So the baby loses out on that if they are not if they don't get colostrum. But also the incidence of things like pneumonia, gastrointestinal infections, ear infections, diarrhea increase when a baby is not breastfed for those reasons, because it's passive immunization. So you can imagine if a mother has had any infection or disease or anything, the body has a database of that, of those antibodies. So they pass into the breast milk. And then for the mother, the things like bleeding, postpartum hemorrhage is reduced because that hormone causes the uterus to contract. It helps with expulsion of the placenta if it's retained and things like that. If It also helps with reducing the incidence of premenopausal breast cancer and ovarian cancer. Premenopausal means before menopause. So, and then it lowers the incidence of osteoporosis, which means, like bone mineral density.
I've also heard that there's an increase of breast cancer because of mothers failing to breastfeed. Could you say that's true?
It is true. It is true. It's one of those things. There are so many associated factors with causation of cancer, but it has been proved that reduces. Then, of course, for the child, their intelligence quotient is improved. Well, they say compared to their counterparts.
You could have been brighter.
You didn't.
Say that.
Just saying.
Thank you so much, Doctor. This has been very enlightening. I wish we had more time. We'd delve more into the discussion on breastfeeding. Of course, if you have questions, do share with us on Facebook or Twitter at BampLoveUG. Our doctor will be on hand to answer some of your questions. Thank you for joining us. That was all we had for you on Bump Love.
Until next time,
with love from Bump Love.